But Obamacare also provides a convenient scapegoat to blame for all sorts of economic ills that either pre-existed or just have nothing to do with the healthcare law. Thanks to a new jobs report today, delayed by the government shutdown, tonight we have facts. And one bit of data in particular that might finally put one of the most insidious lies out of its misery, that Obamacare is a job killer.
Larry, you say blame the health care law for the surge in part-time workers?
Welcome to part-time nation. Not something we want to be proud of.
Obamacare is causing a rise in part-time employment.
In order to comply with this law, they're having to put people on part-time to save their companies.
You hear it everywhere.
And there is a shift in hiring patterns because Obamacare is coming.
It's a talking point repeated by pundits of all stripes.
We can already see the rise of part-time labor.
We are becoming something of a part-time employment country.
Fox News.
We've also cut back on hiring full-time employees.
And by Republican politicians ad nauseum.
Just when we need a full-bore, full-time economy, America is becoming a part-time economy. These are the effects of Obamacare.
Obamacare is a big reason we're turning into a nation of part-time workers.
Because of Obamacare, millions of full-time workers can only find part-time work.
And we're seeing our economy turn from a full-time job economy into a part-time job economy.
We do not want a part-time working America.
A part-time economy, part-time opportunities.
People were being forced from full-time work to part-time work.
We're becoming part-time America because of this law.
It is forcing people to go from full-time work to part-time work.
Obamacare is hurting millions of people. It's killing their jobs. It's forcing them into part-time work. It's
more and more people into part-time.
Forced into part-time work. For all the people out of a job, all the people in part-time work, losing their jobs, being pushed into part-time work, who are losing their jobs, who are being pushed into part-time work, and they're losing their jobs, they're forced into part-time work.
But luckily, we don't have to rely on politicians, pundits, and anecdotes to tell us what's going on in the economy. We also have data. Today we learned full-time employment is up, and the number of people working part-time involuntarily is down since June, and down even more since last year when Obamacare wasn't a factor. In other words, the trend is moving in the opposite direction of the talking point. And when you zoom out a couple of years, since the start of the financial crisis, you see the rise in part-time work starts after the crash and has since gone down, in part while Obamacare has been the law of the land. That shocked economists like Mark Zandi of Moody's Analytics, who thought we were going to see a rise in part-time work because of Obamacare.
Earlier in the year, looking at the ADP data, looking at job creation around that 50-employee threshold, it felt like to me healthcare reform was having an impact, but by the summertime, that all disappeared, and job growth among those size companies is back to,
What, you get a phone call?
But now Zandi admits that the president's health care law is not leading to increased part-time work.
I've expected it. I really have. I just haven't seen it.
The Los Angeles Times today says today's job numbers puts the lie to the popular conservative meme that Obamacare has transformed America's workforce into part-timers. PolitiFact today, government numbers actually show that the fraction of part-timers in the workforce has declined since 2010. And the Wall Street Journal today finds that a closer look at the data provides little evidence for the notion that the health law is driving a shift to part-time work. And yet, the zombie talking point of part-time employment persists because Obamacare has become the easy scapegoat for people to blame for things that were already happening in the economy.
How can you say Obamacare isn't in part to blame for more part-timers?
We look at the data. When we hear anecdotes, we respond to that. But when you look at the aggregate data, it rather overwhelmingly demonstrates that, again, this is a nice talking point, but it's just not accurate. And it's part of the confusion campaign that folks are waging.